things growing, honey.
I know. You just need to see them.
Especially at 4 pounds.
Inside Mercy Medical Center's state-of-the-art neonatal care unit, Terry and Londa Wild keep a watchful eye on their premature newborn son, Sirius.
I've seen and heard of premature babies, but to actually see a 1 pound, 13 ounce your own child, and it just is amazing.
Born only 5.5 months into his mother's pregnancy, Sirius's future was tenuous at best.
They didn't give him very good chances, but they've been taking wonderful care of him, and now he's 9 weeks old and almost 4 pounds.
For Terry and Londa, the first 9 weeks of their son's life have been anything but easy as they watched him undergo test after test and procedure after procedure. For preemies like Sirius, health issues are just a part of life.
You know, preemies can be very sick. It depends on their gestational age, but they need to be cared for in a neonatal intensive care unit.
Among the complications of a premature birth is that of eye development.
You know, premature babies are at increased risk of developing eye disease. It requires careful monitoring by a pediatric ophthalmologist on a regular basis.
That's where Dr. Jean Spencer, a pediatric ophthalmologist, comes in. She makes regular rounds here at Mercy, looking for signs of retinopathy.
The severe form of retinopathy of prematurity leads to what's referred to as a tractional retinal detachment, where the retina pulls off the back. The retina is the film in a camera. It's the lining of the back of the eye, and they're basically blind in the eye.
In order to monitor the development of the eye, Dr. Spencer uses state-of-the-art equipment funded by Variety, called a Retcam imaging system.
But the camera obviously gives you an actual picture of everything.
The Retcam gives a far more accurate and detailed image of the child's eye, especially compared with the hand drawings and notes doctors used to rely on to detect the condition.
They say a picture's worth 1,000 words. In the past, the documentation of what was seen at the eye exam was done with pen and paper. It was really a drawing or a schematic, and now we have digital photography to document what the ophthalmologists see on a weekly basis.
Using the Retcam, Dr. Spencer is able to get a high-resolution image of Sirius's entire eye. She'll use the real-time image to look for and identify any abnormalities and track the progress of his vision.
I think it's good. They said if I want to compare certain features of the ROP from week to week, if a baby's getting to where I'm worried about him, I can show the photographs to the parents and the doctors.
For Dr. Wallig, the Retcam is just the latest example of an invaluable partnership with Variety.
Through our partnership with them, we've been able to get many of the needed pieces of equipment that we need to take care of our babies. And the Retcam is the latest addition to that arsenal. And without the help of Variety, we would not have been able to provide some of the state-of-the-art care that we do to our babies.
Just another example of how the partnership between Mercy Medical Center and Variety provides hope, healing, and trust for the Wilds and hundreds of other Iowa families just like them.
It's amazing. I didn't even know they had that kind of technology.
Knowing they'll both be there to provide vital services when our children and families need us the most.
We still worry about everything, but it's getting a little bit easier now.